know this.
For more than 20 years, CTV has captured the moments that matter in our community. From our studios in St. Clair, you're watching Focus with Paul Dingeman.
Well, hello again, and thanks for tuning in to the Focus program. We've got some important information for you today, as we always try and do. Our first guest is a young man by the name of Ken Cummings. Welcome to the Focus show, sir. Nice to see you.
Hi, Paul. Thanks for having me. I like the part about the young.
Well, the two of us, we're trying to stay young.
Yeah.
You've been a very, very busy man, because there's a thing coming up August the 2nd, which is called a vote, an election, a millage vote, and you are on the ballot with a number of other community services that all are trying to renew or extend or start their millages. What's the story with Tri-Hospital EMS?
Well, I think you're right. This is the summer of millages.
That's correct.
There are a number of millage ballot initiatives that are on the, millage proposals that are on the ballot this summer. Ambulance service millage is one of those, and we have actually never had a millage before.
Oh, okay.
Ambulance services have not relied on taxpayer funding to support the operations until now. But as you said, we do have a millage proposal on the ballot for the August 2nd primary. It is a half mill request of the voters, and it would be for a 4-year duration. So it would have to be, essentially, it would have to be renewed again in 4 years if it was needed at that time. To the average home valued at about $200,000, but assessed tax-wise at about $100,000, it translates into a cost of about $50 per year per homeowner. So that's kind of a rough summary of the impact that this particular millage would have on the voters.
So when I pick up the phone and I call 911, and there's a heart issue, or if somebody's fallen down, or et cetera, whatever the emergency is, I so many times see a Tri-Hospital EMS unit go, but I also see a fire department unit go. What's the story there?
So that's actually, I guess I would say, Paul, that's one of the better systems that we have available to the citizens here. And what that really is called a tiered system of response. Pretty much every community, or just about every community in the county, has a local fire department. Some of them are paid full-time, some of them are paid on call, so they rely on volunteers or people that are on a pager to respond from within that community itself. Unfortunately, because of the cost of ambulance services or ambulances, we can't have an ambulance in every community, and so we share that ambulance among several communities. And the reason we use that tiered system of response is when the caller places that 911 call, they're asked a series of questions by the dispatcher, and based on how they answer those questions determines whether the fire department goes with the ambulance or whether the ambulance goes.
It's not automatic.
Not automatic, no, and it doesn't happen all of the time. But if the situation, based on the information of the caller provided to the dispatcher, suggests that this may be of a critical nature, then the fire department is always sent, and they provide a first response service. They're not paramedics, but they do provide a basic level of care that they can get a person breathing.
Stop the bleeding.
Absolutely. They can stop the bleeding, they can start CPR, they can do a number of things until the paramedic unit arrives on scene for the more advanced care and the ultimate transportation.
Does the citizen then get charged a cost by the fire department and the EMS?
So the ambulance service does charge. That is currently the only source of revenue that we have, is by charging the user of the service. Now, every community is a little different as it relates to how the fire department costs are covered. Some communities, many communities already have dedicated millages specifically for their fire department. And in those situations, it's unlikely they would get a bill because they're already paying for it through their taxes. But there are other communities that don't have a dedicated fire millage, and therefore they would probably extend a charge to their citizens for that response. But again, I don't follow that. I don't really have a whole lot. I really don't have anything to do with that side of it. But from the ambulance side, they would, because again, that is our only source of revenue today is through user fees.
I guess I've heard you speak before, and the point I was trying to get to, and you can expand on it, is how you are paid currently.
Sure.
You go out for every run. That's law or something,
Correct.
isn't it? And then some of them you get paid for, some of them you don't.
Yeah, and that's really kind of brought us to where we're at today in looking and needing a millage to supplement or to support the current operation. Ambulance services have to be available 24 hours a day,
Right.
7 days a week.
Right.
But with the system that we have right now, the only time we are generating revenue to support that ambulance service is when we're physically transporting a patient
Only
to
when
the
you
hospital.
transport.
Only when we transport.
Wow.
So if we respond to your home today because you're having some kind of difficulty, we get there, we assess you, maybe we take your blood pressure, check your heart rate, and you say, you know, I feel better, I don't want to go to the hospital, we leave, there's no charge, there's
Wow.
no revenue.
Wow.
And so we provided that service, and now remembering that our costs for having that service available are fixed 24 hours a day, 7 days a week. But we're only generating revenue to support that cost when we're physically transporting. And that's really what has created a problem for us here in St. Clair County. And if you don't mind me expanding on that
No,
just a
please
little
do,
bit,
please
because
do.
one of the major reasons why we need to look at a millage to supplement ambulance funding here in the county is because demand for ambulance services has actually increased pretty significantly. Over the past 10 years, we've seen requests for ambulance services go up by 31%.
Wow.
So it's pretty significant growth. The problem with it is the bulk of that increase is really non-revenue generating calls. It's people who call 911 because they saw a car go in the ditch. So we have to have resources available to respond to that, to verify that there's no injuries, but there's no revenue generated from them. But again, our costs are fixed for that. Or we have a lot of clients that will call us because they're homebound, they fall and they cannot get up, and so they will dial 911 and ask us to come out and to assist them with getting up. Again, no charges are rendered for that type of a response. Yet we still have to staff and equip our organization to be available for that request when it comes in. And quite frankly, those types of scenarios have created a significant burden on our organization, and that, you know, we are busier today than we have ever been. However, we're actually generating less revenue.
Wow, that's
than
not good.
No, it's not at all. It's a bad combination.
Round figures, how many calls do you make in a year?
We respond in our entire service area. We're the largest provider. We are not the only provider in the county. And the other thing I would just emphasize before I answer that question, Paul, is that this is a countywide EMS proposal, not a tri-hospital EMS. Although we are the largest provider in the county, we cover, I think it's 26 of the 31 municipalities in the county. We provide their service, but we will respond to about 23,000 requests.
Hold it, 23,000.
23,000 this year alone.
Wow.
Correct.
And hey, do you have an idea of how many of those you don't get paid for?
Generally speaking, historically, we've had about a 20% no transport rate. In other words, 20% of that results in no patient being transported.
But you've gone.
But we've responded. We absolutely have responded. We have to respond by law. We have to be staffed and equipped to respond to every request, but we only generate revenue when we actually transport somebody. But what we've seen over the last 3 or 4 years, in particular since the pandemic started, is more people are calling 911 than have ever called before. And we're seeing that fewer and fewer people are actually going to the hospital. Many of them don't want to go to the hospital. They would like us to come out. Yeah, well, they are. And quite frankly, they want us to come out. They want us to assess them, let them know if there's anything irregular in their heart rate, if there's something going on. If we find something, generally they'll go to the hospital, but often we find that they just want the reassurance of knowing that there's nothing serious going on. So there's a cost for that.
I think this is pretty important information that probably most of the people in the county don't know that you're giving us today. The fact that you don't get paid for a great portion, that you've never had a millage before.
Right.
Has the state ever tried to pay for ambulance services?
So we do get reimbursements from the state, again, only when we transport, however. And so But the reimbursement rates that they provide are incredibly low. So part of the problem we have as an organization is ambulance service reimbursements. The majority of the payers are Medicare for senior citizens, Medicaid through the state, and then Blue Cross Blue Shield, one of the major commercial carriers. Those three payers alone comprise 94% of every ambulance call we go on.
Wow.
Those three payers dictate to us how much they're going to reimburse.
Oh,
We
do.
have no input on it
Oh.
whatsoever.
So if your costs go up, they don't necessarily
change.
care.
That's correct. So when our costs go up, we have one of two options. We can reduce services, like many organizations do, to try to get our expense below our revenue, or we have to look for additional revenues. And right now, as I said earlier, when demand is actually on the rise in this county, reducing services really translates into poorer service to the public, and we don't want to do that because that's not good for the health and safety of our communities. So the only other alternative we have is to go to the voters and ask them if they would support additional funding to help us through this period of time when revenues are far lower than the costs.
How many units do you have on the road?
We operate, depends on the day, but typically we have 10 ambulances on the road all of the time. They are very strategically located throughout the county. We have them located in order to make sure that we provide good response times to the entire area, but we have a vehicle in Capac, one in Yale, we have one in Kimball Township, we have two of them in Fort Gratiot Township, two in Port Huron, one in East China, one in Clay Township, and then another one in Anchor Bay. So that's kind of where they're located.
And I've heard you say and mention too that like every other industry in the world today, you can't find enough people to come to work.
Staffing is a huge challenge. In EMS, it's a little bit more unique because we can't just hire people off of the street. Anyone that works in EMS by state law must be licensed. To be licensed, you have to go through a pretty rigorous training program, pass a national registry exam before you can even be eligible to be employed by an ambulance service. And like many of the industries, we have seen a drop in people interested in pursuing this industry. And so we're trying to recruit from outside of the county to draw people into our organization to work for us. But one of the strategies, and quite frankly, this millage will help us provide this service, is it will allow us to increase our wages to try to draw more people in and get our wage up to a level where we can compete with other markets. But the other part of it, and I believe this is a really important part for us, is we believe we need to train these people locally. Yeah. We were doing it through the community college for a number of years. In 2020, they got out of the EMS training business. And so that left us with no training program available. So we're getting back into it, but there's a cost to that.
Are you going to do the training?
We are. We're actually going to do it right within our organization, and we have our team assembled, and we are working on developing that program so that we can produce anywhere from 8 to 10 paramedics every year.
Wow.
And that will help help us staff our organization.
Well,
so
there's lots of information available, and if people want to get it from more information, how do they do that?
Well, they can go to our website, THEMS or thems.org. Thems.org, and that stands for Tri-Hospital EMS. It's the acronym for us. But the other thing is there is a website out there. We do have a committee that's assisting with the campaign, and I believe the committee website is sayyestolocal.ems.com. So they can go to that, or again, they can go to our company website, and there's a link to that other web page for them to go to. And it has all the facts and all the information about why this millage is necessary, and they can get all the information.
And that's really why you're here today. You want the voters to take a look at all the information they can get and then make their own decision on whether they can support you or not support you. So,
we are well aware, Paul, that this is a difficult time economically for everybody, and this is the last thing in the world that we want to do. But it's also
it's the first thing they want to.
Well, and cutting service is the last thing we want to do as well. So we want to at least give the voters an opportunity to help fund it, to keep it where it is, and to allow us to provide the service that we've been providing to the community. But that's ultimately up to the voters.
Ken Cummings is the man's name, and he's the head of the Tri-Hospital EMS. And if you need more information, just go on the web pages there and find it, and make sure you get out and vote on August the 2nd. We'll be right back with Deb Johnson. We are back with a person who is just busy, busy, busy every month, and we are so glad to see her every month, Miss Deb Johnson.
Hi.
Executive Director of a great agency by the name of St. Clair County Community Mental Health.
That's a mouthful, isn't it?
That's a mouthful, but you handle it very, very well.
Thank you.
Babe Moore Campbell National Minority Mental Awareness Month. That's a big title.
It sure is.
What's it all about?
Well, in 2008, the U.S. House of Representatives designated July as National Mental Health Minority Month.
I told you, it's a big one.
You got it doesn't really matter what order, I guess, but the issue is mental health awareness for minority populations. B.B. Moore Campbell she was an author, a journalist, a teacher, a huge mental health advocate, especially for underserved or underrepresented populations, and specifically people of color. So the day was created to bring awareness to the unique struggles that people with minorities have. In whether it's in accessing care, getting care, etc. And we know that although individuals that are Black or other underrepresented, they don't necessarily have a higher occurrence of mental health issues, but they definitely have a lower occurrence of actually seeking treatment. So the question is, why is that?
Right.
And I bet you, after all of our talks, could guess the number one reason. What do you think it is? The number one reason they don't come in for treatment?
Fear?
Stigma.
Huh?
Stigma.
Oh, oh yeah, stigma.
Stigma. And so, fear probably factors into that, but stigma, and it's even sometimes it's stronger in certain cultures than others. And so it's definitely
traditionally their parents didn't seek help, so they're not going to seek help.
Or they think that they should take care of their problems or their situations within their family or within their own communities, not an outsider or whatever.
Yeah, okay.
So that continues to be the biggest reason. And so sometimes access to care might be an issue for some people. I hope that's not a problem in St. Clair County, because even if minorities tend to have less insurance coverage, like the percentage of people with insurance versus without, it's less people for people of color, and so. But in St. Clair County, hopefully that doesn't really matter, because we see everybody, whether you have insurance coverage or not. And also since we became a CCBHC, which we talked to you about on different occasions, that's a certified community behavioral health clinic. We can see people with less severe conditions. Before, we could only serve the most severe and people that were, as defined in the mental health code, and that dictated who we could see. Period. Mm-hmm. That's changed now. It's expanded, and we can see people with mild to moderate mental health conditions, and we couldn't before. So anyways, yeah. So that's.
Okay. Mental difficulty, seeking advice, mental health. Also, National Recognition Days. What are those? National Recognition Days. Self-Care Day, International, July 24th.
Yes, that's a good day, International Self-Care Day, because self-care is important for all of us. We talked a lot about that during COVID, about how important it was to take care of yourself. During COVID, we know that people were experiencing higher levels of anxiety, depression, just feeling disconnected, maybe gaining weight, just feelings of being sad or, just bored, whatever. And so we were talking during that time, all the things that you can do to help yourself. Take walks, exercise, eat healthy, limit the amount of TV, of negative things that you watch. That's true all the time. That's good advice for self-care all the time. Yoga helps, meditation helps, getting a massage if you can do that. whatever. Some people like to garden, and that brings relaxation. Some people like to bake or cook or whatever. Whatever it is that helps you to feel relaxed, kind of get in touch with your feelings, those kinds of things, that's all good self-care to practice. And so on the 24th, which is International Self-Care Day, that's a day to especially focus on the things that you can do to take care of yourself. Because we said this before too, that if you don't take care of yourself, how can you take care of anybody else?
Absolutely.
And most of us have some other responsibilities in our life.
And we've talked about the self-help. We've talked many times before about caregivers themselves. They really need to take care of themselves.
Exactly. People who are caring for individuals with, whether it's with intellectual developmental disabilities, mental health issues, substance use, Alzheimer, dementia, Alzheimer. Those folks need to really especially take care of themselves, because it's very emotionally draining, their jobs, and physically exhausting too.
Yes.
So they got to make sure they get the proper rest and just really take care of themselves and not feel guilty about it, because sometimes people think, no, I got to do this and this before I can do anything for myself, and they shouldn't feel that way. I mean, you have to take care of yourself. So
They sort of tie together, don't they?
they sure do.
Okay, what else you got there?
Well, I do want to tell you, I did also in the month of July is International Friendship Day. And that's something we always talk about too, because, International Friendship Day is July 30th, and then the National Friendship Day is always in August, which I don't really understand who decides when these days are, unless they're designated by like Congress, which a lot of them are, but these are not. But what we've talked about this before too, I know, because sometimes people who have mental health issues, it's harder to make or maintain friends. And so one of the things that I like to say and we like to talk about is that if you have a friend who gets diagnosed with a mental illness, or even if all of a sudden you find out they have a substance use disorder, remember that people don't choose to have these things. Take some time to learn about it. Their disease is just like having cancer is, or heart disease, or whatever. So take some time.
It's a disease.
Yeah. So learn about it. Take some time to learn about it. How can you support your friend? Stay their friend. And sometimes, depending on what their situation is, maybe they don't want to go out socially as much, but keep inviting them, and maybe try to do things that are more geared for one-on-one, or listen to them when they talk, things like that.
I like that term, listen. We should all do that more, whether they're ill or not ill. We have to listen to one another.
Yes, listening and try to listen fully focused. And sometimes I have trouble; I get distracted.
Right.
But
there's televisions going and radios going.
Different things going on. But try to listen and pay attention. Active listening is where you kind of repeat back what you're hearing, so that might be helpful to some people to stay focused on the conversation with whoever they're talking to.
Okay.
So anyways, that I also just looked when I was going through looking at some of that stuff. I love playing Words Free with Friends on my phone. And July 19th is National Words with Friends Day. So if you play that game, reach out to your friend that day and play a word.
I saw one years ago when I was in radio. There was a book, and it probably still is there, with every imaginable day that there is, 365 days a year.
There's like chocolate day, chocolate with almonds day, peanut butter day, hot dog day, different colored eyes day. That's in July too sometimes, because I was like, does that mean a person with two different colored eyes? Because my husband actually has two different colors.
I'll have to look that up and get back to you.
I know, me too. But yeah.
All right. You got a couple projects coming up. There's one for Alzheimer's. What's that one about?
Well, as you know, a number of years ago, we created under the leadership of Marcia Haynes.
Wonderful woman.
Wonderful woman. May she rest in peace. She passed away not that long ago. But this is her legacy that we're going to continue and keep it successful, because her mission was to make sure that there were appropriate resources and information for families when their loved ones diagnosed with dementia or Alzheimer's. So, because her husband Fred had Alzheimer's. Yep. So, anyways, she started the Dementia Alzheimer Resource Committee of St. Clair County. It is now a 501c3 nonprofit. It's been for a number of years. I currently am the board president of that. Okay. We have a number of people that participate on the board and do a lot of work, and we have a run walk. It's the biggest fundraiser for the nonprofit. It's on September 18th. There's a 5K timed run, or you can do a walk. And you can walk cover whatever distance you want. If you're doing the walk, the run, you got to run the whole 5K if you
Okay.
want it to count. And so that's at noon. It's a Sunday. And so we have that going on. There's sponsorship opportunities, all levels, starting at 100, going to 1,500. Although we would take a check for 5,000 too, if you wanted.
All right. You accepted all the money.
Yeah, we'll accept any amount. The other thing that we do is we provide respite care services for families who have a person with dementia, Alzheimer's living with them, and they need a break. So we don't do the service, but we provide the money for them to pay for somebody to come in and provide.
Well, that's wonderful.
Yeah, specialized
'Cause
care.
That's a very trying time, is to be supporting somebody with dementia.
Mm-hmm.
And they do need breaks, and they do need them often. And you'll provide the cash to
Up to
bring somebody-
$1,000 a year.
Wow.
There's an application. You can go on the dark web, Dementia Alzheimer Resource Committee website or Facebook, and I think go to the website. It's probably the easiest way. And there's a thing for respite care services. You click into it. There's an application you fill out, and it gives you all the instructions.
Wonderful.
And it's not a very hard application.
Wonderful.
Yeah.
Okay.
So
July the 12th, one of your favorite loves is coming up.
is it the 12th or the 11th?
Uh-oh.
It's the Monday. Whatever that Monday is.
I don't know why I thought it was the 12th.
It was the 12th, I think, a year ago, but I feel like it's the 11th. And I don't have the flyer sitting in front of me, but the St. Clair County Child Abuse Neglect Council golf outing
Right.
is at the St. Clair Golf Club, and it's on Monday.
Well, let me pull up my phone.
I think it's the 11th.
I'll verify it for you. You fill while
Okay, that's a great outing. We have 2 flights. If you want to golf in the morning, come out at 8 o'clock, and you'll get a lunch after you're done. There's an afternoon flight that starts at 1 o'clock. We have
July the 11th.
Okay, good. Thank you.
You are right.
All right, that's good. And so we just want to make sure that your viewers know, because if they want to sign up, you can register online. You could pick up a form probably from the Child Abuse Neglect Council, drop a check off. If you know me, you can give me your money and I'll take it. And we're always looking for auction items too, so if anybody wants to donate, we'll take that.
I've just come out of the universe, out of my spaceship. I don't know what CAN Council is. Tell me.
Oh, sorry. I'm so bad with that. We use acronyms for everything, don't we? So that is the St. Clair County Child Abuse and Neglect Council.
And what does that council do?
They provide a lot of prevention education for our children so that they understand the difference between, say, good touch and bad touch, or
Okay.
inappropriate.
Very good.
And also what should you do if you're in a situation like that, or who do you report to? So we also, that's at elementary school level. There's a program at the middle school level. There's internet safety and things like that. And then also at the high school level, dating, safety, still also internet kinds of things.
That's wonderful.
Yeah, and on some of those, Lindsay Chop, who is from this area, as many people know her, is the prevention educator. She does most of those education events on her own, except she does some of the, I think the high school one, somebody from the prosecutor's office joins her.
Oh, good.
And talks about the legal aspect of some of that stuff. And so, yeah, so we do that. And then also, if a child is a victim or the alleged victim of child abuse, physical abuse, or sexual abuse, they can be interviewed at the Child Abuse Neglect Council facility in Port Huron by a trained forensic interviewer. And hopefully, they just have to have the one interview, because at that interview, there's the one-way mirror.
Mm-hmm.
So on the other side of the mirror, the child's just with the interviewer, but then the prosecutor can observe, law enforcement, lawyers, whoever. So hopefully the child doesn't have to be re-traumatized multiple times by having to go through that. Sure. So that's basically what they do. And there's also, you can get more information on Facebook or on the website.
So the aforementioned Monday, July the 11th, we've certainly knocked the heck out of that date.
Yeah, July 11th.
Is the CAN Council golf outing at the golf course at the St. Clair Golf Club, and you raising money there to help support.
To help support the programming, yeah.
Great.
It's a really small budget. They do a ton of work with the limited budget. We have been expanding the services, actually, which I didn't even talk about, but there are some trauma-trained counselors that can help kids, because obviously if you are the victim of child abuse or neglect, you have been traumatized.
Right.
And you need some help with that. And so we have some therapists there, and we do different kinds of, like there's groups, there's all kinds of things. So, and I know you've had Sherry on here before, but I think she should come on again pretty soon.
All
and
right,
talk
we'll
and-
do that.
Yeah.
We'll
and-
do
and
that right
talk.
after you.
All
Not
right.
today, but
Not
another
today,
day.
a different day.
Anything more there that you have for us this
I
visit?
think that's it for today, I think.
Well, I want to give you some advice.
Yes.
And that is on July the 11th, hit him straight right down the fairway.
I'm going to try. Thank you.
That's about it for this edition of the Focus program. I'm Paul Dingeman. Until next time, see you soon.
Thanks for watching Focus with Paul Dingeman. Focus is produced at the CTV Community Television Studios in St. Clair. For over 20 years, CTV has captured the moments that matter to our community.